think what it tells us is the antibiotic crisis is real, it's rapidly getting worse. Our Georgian, Polish and Russian colleagues, they've been right all along. Phage therapy does work, and I'm sorry if you ever doubted them, but it's not straightforward. There's a lot of nuances and details that we're not sure about yet. And one of the things, you need excellent microbiological skills and the treatments. That each patient is handled differently, so it's largely empirical. There's no set protocols for handling these. So we definitely need more guidelines from experienced Phage physicians, and we definitely need more training for our local physicians in our countries. But who's going to be doing the teaching? There's very few of these experienced Phage physicians around. Most of them are retired. And whenever we get a case, we deal with a French physician who used Phage therapy for over 40 years. And he's our reference point because he has considerable experience in different cases. So I think some of the lessons learned, each case will be different, and Phage definitely will be used in conjunction with antibiotics, not on their own. And this trickle of patients that we're seeing is going to become a flood. It's an enormous demand, and I think despite that, there's still 99% ignorance and considerable skepticism amongst the scientific and medical community. But on the other hand, there's tremendous support and great goodwill from the general public. So we have this urgent need to train clinicians in Phage therapy. And we also have an urgent need to establish international networks so that we can all talk to each other. And I think that's one of the themes of this conference. And of course, the big one here, as we just heard in one of the speakers earlier, nobody really knows what's going on with the regulatory side. You know, it's very confused. Lessons learned 3. We've got to avoid this debacle that took place in the 1930s, where there's a decline in the industry. And one of the things we've got to avoid is we've got to avoid excessive claims of miracle cures, you know, and newspaper headlines. We've got to keep that down and get the science right so that they can proceed to the next stage. And we've got to have this solid platform, this good logic. You've got to make sure people realize it's not a 100% guaranteed cure. And in some situations, Phage therapy will be of no use whatsoever. We've got to point that out. Resistance will occur, and Phage therapy should really be regarded as another tool and not some miracle technique. This regulatory confusion and the IP funding side, that's another thing that we've had to contend with. The patent situation is very like monoclonal antibodies, where the original invention was not patented. And then, of course, there's a great scramble to try and patent monoclonal antibodies. Here again, the original invention was too old to be patented, and there's a big scramble going on with patents, but it's very confusing. And of course, if you don't have patents with investors, they don't want to give you money. Pilot and large-scale production, and this is very important thing. We've got to have an industry body where we talk about all these things. And this little cartoon is the Declaration of Phage Independence in 2008. And because I think this is an inaugural meeting to talk about it, I put this up. This is George Washington Phage. I'm not sure of his family. We need very strong international networks, so I say we've got to aim to establish Phage therapy. It's got to somehow go from its mistrusted old reputation from back in the 30s and 40s, and it's got to be rebranded or reintroduced as a viable, trusted, complementary treatment for resistant bacterial infections. We must avoid this repetition of the discussions and furor that took place in the 1930s, where all the great scientists were fighting each other and incandescent with rage, wondering whether, fighting about whether it was an enzyme or a bacteriophage or a virus. At all costs, we've got to avoid the hype. We've got to keep the cowboys out of the industry. The future. So after a rocky start, we're seeing this Phage therapy emerging as a major industry for the 21st century. And I call it the pharmaceuticals industry because it separates it from pharmaceuticals and nutraceuticals. it's not up here, but we know the size of this industry is going to, already the resistance, they call it the resistance industry, is worth $24 billion. And that's the size of the market for products to address resistant organisms. So there's enough money, enough targets, and enough work to go around many times over. In the future, I see a situation where every hospital will have a bank of broad-spectrum phage cocktails ready to use, as well as an extensive bank of monophages, so that once, if the situation is not critical, you can take isolates, culture, and match the monophages for more individual phage treatment. And these isolates from the patients will be phage type, probably in very, very rapid systems, a few minutes, and the pharmacies will be able to make up the patient-specific cocktails. So truly individualized medicine. Now, in the future, who's going to be doing all this work? Because I'm going to be retired, I'm going to be playing golf. All right, I'm sure Reza has some other ideas. Many of the Georgians are in the retirement. So, who's going to be doing this? We need a new generation of scientists and clinicians coming through who will replace and take over from those who've managed to bring this technology as far as they have. There's no point in us keep phoning up clinicians who've retired and asking them to say, I've got an urgent case here. So I'm going to end this talk by appealing to all the young scientists out here, because it's your job, it's going to be your job to take over. So become a phagician and see the world. Okay? And finally, for any budding phagicians who would like to spend some time in Sydney, please let me know. We can't promise you a large salary, but plenty of sunshine, plenty of sewage and seawater, and this is Crocodile Dundee phage. This figure here is not the name of the bacteria phage. This is for the New Zealanders. Are there any New Zealanders in the audience? This is the score that Australia beat the All Blacks. Oh. On Saturday. I'd just like to acknowledge my colleagues and Russian colleagues, because really the fact that this technology has disappeared. My Western colleagues and collaborative staff and the New South Wales State and Australian government for their support. Thank you very much.